And welcome down to Forefront Live. What happens before and after COVID-19? Pathologist Dr. Daniel Arber will join us to talk about options for COVID-19 testing, details about antibody tests, and more. And later in the program, Dr. Deborah Burnet and Dr. Ratain will discuss treatment options for COVID-19 patients with lingering symptoms through UChicago Medicine's new post-COVID recovery clinic. We'll answer your questions during our live 30-minute Q&A. We want to remind our viewers that today's program is not designed to take the place of a visit with your physician. This is all coming up right now on At the Forefront Live. And welcome to the program, Dr. Arber. We're going to start off with you first telling us a little bit about what you do here at UChicago Medicine.
Medical director of the laboratories at the University of Chicago. So we run all the laboratories and deal with all biopsies and any type of specimens that need to be tested.
Excellent. So tell us a little bit about the COVID-19 test. Obviously, that's at the top of everyone's mind right now. There are various tests out there. Can you kind of describe what they are and what the differences are?
There are a lot of different COVID-19 tests, and they range from based on different methodologies. The one that is most used, at least in our medical center, is a PCR test, which amplifies the sequence of the virus. So it's very specific for a virus and can pick up very low levels. There are also antigen tests that are out there that have been approved. These are much faster tests that usually can be done in 15 to 30 minutes. They have some problems in that they can have some false positives, and they're really most useful for individuals that have symptoms. They're not as good at detecting people that are asymptomatic. And those tests are recommended to be followed up with a PCR test, which takes a little longer to perform. And then the last group of tests are the antibody tests that we can talk about more.
Yeah, so tell us a little bit about that, because obviously they each have their pluses and minuses. And I think, you mentioned the second one, speed is pretty important with that one, or I guess a positive of that one, but maybe not quite as detailed as some of the others. So why do we do the tests that we specifically do here?
Well, we do the PCR test as our main test because it's the most accurate test. And we can do it relatively quickly, usually within 24 hours. And that's usually satisfactory. But that's not as great for screening someone like in a nursing home where you just want to quickly know if they might have COVID-19. And then the antigen test may be appropriate as a first-line test. And then you can follow it up with a test that takes longer to confirm.
And I think most people, when they think of the various COVID-19 tests, they think of the ways they actually receive the test. For example, the nasal swab or the saliva test. Can you tell us how those work and which one corresponds to which test?
Yes. So the PCR test and the antigen tests are usually done on nasal swabs or nasopharyngeal swabs. Sometimes they're done on saliva, and when the test is optimized for saliva, that can work pretty well, particularly for screening tests. The antibody tests require blood draw. And so the nasal and nasopharyngeal swabs are really just mean putting a Q-tip-like device into your nose. If it's nasopharyngeal, it does have to go up farther in the back of your nose and through into the back part, which can be a little bit more uncomfortable.
And I think that's what we're seeing in the drive-up testing. That this is video that was taken at UChicago Medicine back, I believe, earlier in the summer or the spring, and it's kind of interesting. I've actually had a couple of these tests done personally, so I've experienced it myself with the nasal swab. And so that brings me to the next question, which is the one that everybody asks, but I'll let you answer, and then I'll chime in with my own experience. Does it hurt to get a COVID-19 test?
Well, if you get a nasopharyngeal swab, it's pretty uncomfortable because it has to go pretty far back, and that's sometimes necessary, particularly if there are other tests that need to be done other than COVID-19. And also, there are also some supply issues where sometimes we can't get the more comfortable nasal swabs, although most of our testing now is on nasal swabs. And again, that goes to the back of your nose, which isn't the most pleasant experience, which I'm sure you can vouch.
I can vouch for it, but I do want to make sure that people understand that if you have to get a test or you need to get a test, go ahead and get it. It's not that terrible. I mean, it's uncomfortable. I think that's the best way to describe it. It's not searing pain or anything like that. It's a little uncomfortable. It only takes a few seconds. I think they counted to 10 when they did it, and it really wasn't that awful. And you were correct, though, on the results. The results are actually pretty fast. I was really kind of impressed with that.
Well, we have a pretty high throughput laboratory built, and we promise results within 2 days, but most results are less than 24 hours. And if you have it in the morning, usually we can result it later that day.
Yeah, I think that was exactly how it happened. I went in first thing, and by the afternoon I knew. And we actually have some lab video if we can. We'll roll that here in a minute. But it kind of shows what happens here at UChicago Medicine and how busy everyone is. I mean, this is a laboratory environment where people working 24/7 to get these tests turned around, and it's a huge effort on behalf of your team.
It is, and we have different sites where we're doing testing. But in the last few days, we've done over 2,000 tests a day, and those are resulted, over 90% are resulted in less than 24 hours.
Now, we want to remind our viewers that we will take questions live on the air as we talk about COVID-19 and the testing, and later on in the show, kind of post-COVID and what happens to people. Talk to us a little bit about drive-through testing. We had video of drive-through testing earlier in the year. Are we still doing that?
Yes, we have this curbside collection. We don't actually do the testing right there, but it's collected at the curbside. You have to have an appointment to do it, and you come in at your time. They're ready for you. There's very limited contact with the person that does the collection. They're wearing protective equipment. You roll down the window. They collect the specimen, and you confirm your identity, and you move on. So it's a very efficient process. I brought my son in for it a few weeks ago, and it worked very well. And he actually had a nasopharyngeal swab and handled it quite nicely.
You know, I will apologize. I think my terminology or my use of terminology probably isn't 100% accurate. When I was talking about testing, we're really kind of talking about a couple of different things. We're talking about the actual collection, which is what you're seeing with the folks at the drive-through area, and then the testing is what you do in the lab, and that's where kind of the work on the back end happens, where we determine if people have it or not.
That's correct.
So can you talk to us a little bit about what's involved in processing the test? We see the collection, it goes down to the lab, and then what happens in the lab area?
So it's collected and then put into a small amount of liquid called a transport media, and then walked over to the laboratory, which is in an adjacent building. There it's processed, and that confirm the identity, make sure it's in the computer system. And currently, if you're asymptomatic and we're testing you, we pull the sample where we actually mix a number of samples together and run them, and then it goes onto an automated machine that extracts actually the nucleic acid of the virus out of the sample, and then tries to amplify it to see if there's actually virus there. If you're asymptomatic and a pool is positive, then we go back and test the individual samples. That's allowed us to save reagents and actually get faster results for many patients.
And we are getting some questions from viewers, and our first one, if you have a cold, could you be marked as positive? And I don't know if you can explain kind of the details of that too.
So if you have a cold and you come in to be tested, then you would be designated as symptomatic, and your sample would be directly run on the instrument. But the test is very specific for COVID-19. And if you have another virus, it will not come up as positive. We are implementing other tests that would look for other viruses like flu and other respiratory viruses, but it would tell us that you had that virus, not COVID-19.
So how reliable are the tests overall? Because we hear reports of where somebody is negative one day but positive the next, and of course we have to realize that you could maybe get it on that day that you're negative. But can you talk us through that?
Sure, it does happen. At some point you're not positive 10 minutes after you interact with someone who has COVID-19. It takes a while for the virus to grow enough in your body to become positive. So we may sample your nose, and it may be negative today, but tomorrow you may have enough virus that becomes positive. So if you're symptomatic and you have a negative test, it's recommended that you be retested if you're not improving in a few days. But The vast majority of people we can detect, once they're symptomatic, we detect them with the test.
So how long after? Oh, I'm sorry. Go ahead.
There are also examples where you may be positive when you're not sick anymore. And we don't recommend people get tested if they've had COVID-19 because the test could come back positive even if they're asymptomatic. And that's just because they're very small remnants of the virus. It doesn't mean you're infected anymore.
Interesting. So how long after exposure should someone get tested?
So our contact tracing recommends that if you've been exposed, you should be tested between day 5 and day 9 after the exposure. If you become symptomatic, you could be tested earlier, but if you're asymptomatic, it's recommended on the 5th to 9th day is the window that you'd be most likely to be positive.
So does UChicago Medicine offer free COVID-19 testing, and what is the best way for somebody to go about getting a test?
Well, to clarify, COVID-19 testing is at no charge to the patient. It is insurance companies pay for it, Medicare, Medicaid pay for it. So we do ask for information. So there's sometimes confusion that it's free. It is free to the patients, and that there's never a charge to the patient for COVID-19 testing. The best way to get a test is to contact your primary care provider. If you're a patient at University of Chicago and you have a MyHealth account, you can go into MyHealth and request a test. There are also phone lines that we have available for existing patients. But in general, it's best to go to your primary care provider, and they have a mechanism to get you tested.
Another question from a viewer. My husband has COVID and pneumonia and is coming home from the hospital today. I have tested positive, but I am asymptomatic. How long do we quarantine? That's a tough one.
That is a tough one, and I don't have the exact answer because I don't usually advise people, but you do need to be quarantined for a specific amount of time since the time that you tested positive, and you were probably given that information at the time of the result.
Probably a good idea for them to reach out to their family physician, I would imagine, and maybe have a discussion with that person as well. That first half of the show flew by, Dr. Arber. I really, really appreciate you joining us. You did a great job. We will take a quick break. When we come back, Dr. Deborah Burnet and Dr. Mark Ratain will join us to talk about treatment options for those who are dealing with post-COVID symptoms. I love the sneeze in that. I know that's not a COVID symptom, but I love the sneeze in that. That really grabs your attention. Welcome back. Dr. Deborah Burnet and Dr. Mark Ratain join us now to discuss post-COVID symptoms. Welcome to the program. Can we start off with having each one of you tell us what you do here at UChicago Medicine? And let's start with you, Dr. Burnet, because you're to my immediate left on the screen, it looks like.
Sure. I'm a general internist and pediatrician. I'm the chief of general medicine. That means I lead the primary care faculty, and I help them develop their work, and I study healthy nutrition and exercise for kids, families, and adults.
Dr. Ratain?
Hi, I'm Mark Ratain. I'm actually a medical oncologist and associate director of our cancer center, but I'm also a clinical pharmacologist that has spent most of my career developing drugs to treat cancer. And so now I've obviously become very interested in developing treatments for COVID and potentially to prevent COVID.
You know, it's interesting. We've heard a lot. COVID is kind of a continuing unknown to some degree, and we're hearing a lot about the lingering symptoms that have been found in patients after they recover from COVID-19. Can you talk to us a little bit about those? And Dr. Burnet, let's start with you. What are you seeing?
Well, many patients heal up well and feel good within a couple of weeks, but some patients do experience lingering symptoms. Those can be more common in people with other underlying conditions or people who have had more difficult illness with their early COVID. But the symptoms that can linger include fatigue, shortness of breath or cough, joint pain, chest pain, also changes in mood, headaches. Many other symptoms are possible: sleep problems, difficulty concentrating, or brain fog.
So we are already taking questions in this segment from viewers. We're getting some in, so we want to get to as many of those as we possibly can. And Dr. Ratain, I don't know if you can take this one, but we'll throw it out there. I was tested positive 15 days ago. I've been down with a terrible cough. I tested negative this Sunday, but my cough is still very bad and still have no sense of smell. Wanted to see if I'm in the safe zone now. Is there a possibility of getting sicker at this stage?
Well, I don't think there's a real possibility of developing a acute complication of the disease, but what we don't know is the prognosis of these symptoms. And these are the kind of patients that we're hoping might be interested in coming into our post-COVID recovery program, which starts with a initial visit with either Dr. Burnet or one of her colleagues in our primary care group, and then potentially referrals to various specialists. In this case, this could include a referral to one of our ear, nose, and throat physicians, as well as a referral to our pulmonary group.
Interesting. And Dr. Burnet, can you talk to us a little bit about the post-COVID recovery clinic and give us some more detail on what happens there?
Yes, so we see patients who have had acute COVID and either tested positive or there's a strong likelihood that the illness they had was COVID. Some people did not have access to tests or may have missed the actual window. But for people who have persistent symptoms 2-3 months down the line or even longer, we will do an initial video visit with them and assess the symptoms. We ask questions, of course, about their initial course of COVID, but then what has transpired since then, what symptoms are still persisting and bothering them, and what kinds of care they've had in the interim. And then we work with them. We order other labs or tests if there's something that's needed, or we will help them see a specialist if there's somebody in particular that they need to work with.
Another question or comment from a viewer. I had COVID in March and I still have low energy and fatigue since then, and I guess the question would be, is that a normal occurrence?
I don't know about the word normal. It is not terribly uncommon. The course of, first of all, fatigue is by far the most common lingering symptom. Many patients have it during their initial infection with COVID, but many patients experience a lingering fatigue that can last weeks or even months. So over time, most people do begin to get better and recover, and there's a wide variability in how long that takes for individual patients. So I wouldn't say it's essentially normal, but it is common, unfortunately.
That is too bad. So another question from a viewer. This is Stephanie asks, what are some of the ways that COVID may affect the heart? Have we seen much of that?
There are ways that COVID can affect the heart, both during the initial infection or also in the longer term. We're focusing right now on the longer term symptoms. And one of the things that is not uncommon for patients is to experience a racing heartbeat, palpitations, et cetera, especially when standing up or exerting oneself. For patients that have that kind of symptom and problem, we do want to see them, assess them, and if it's appropriate, get them in to see a cardiologist, check an EKG, and possibly other tests.
Great. Dr. Ratain, are certain individuals more susceptible to becoming like long haulers and experience the symptoms that continue? And if so, who's more at risk in that area?
Well, there's certainly an increased risk in older patients and an increased risk in patients that had more severe acute symptoms. But there are many younger patients and many patients who had only mild symptoms that suddenly find out that what they thought was just going to be a mild infection because they're young and previously healthy has turned out into a chronic or at least subacute illness that in some ways for some patients can be debilitating and interfere with ability to perform work and other normal daily functions of living. So, but we're still trying to understand the the cause of all this. We don't know, for example, whether some patients have chronic infection that we can't detect, or perhaps it's the immune system reaction to the infection, and thus we don't really know whether to try and increase the patient's immunity or suppress their immunity. And these are questions we're trying to understand, and these are the kinds of therapeutic approaches we're developing as part of our clinical trials program.
Another question from a viewer for either one of you. I tested positive with on and off chills and body aches, and then got diagnosed with pneumonia last Saturday, it looks like. My son, who is 4, tested positive also with no symptoms, though. After we got retested, our 10 days still came up, and we were positive again. How long does my son have to wait until he's negative?
I need to think about the numbers. Generally, people are considered infectious for 2 weeks after a diagnosis or after a positive test in the context of an exposure, or even an exposure without a positive test. So 2 weeks is the most common period of time that an individual needs to wait. Now, some people who have been extremely ill or very bad acute symptoms may actually be infectious slightly longer. So for those individuals, it's recommended to wait 3 weeks. So I would still have to go back through the different numbers that were presented there. But generally, 2 weeks from the time of onset or diagnosis is considered the window.
Interesting. Dr. Ratain, are lingering symptoms more commonly associated with severe cases of COVID, or does case-by-case severity not matter?
Well, there's definitely an association between the severity of the initial illness and the probability that a patient will have complications. But again, patients with very mild or even no symptoms can develop late complications of COVID.
So, Dr. Burnet, what should a patient do if they are experiencing lingering symptoms?
Well, the first thing is, one thing is reach out to your doctor. The other things are to give your body every best chance to heal. And by that, I mean to rest, hydrate well, get enough sleep, etc. But certainly for patients who are having concerning symptoms, they need to reach out to their physician. And we are also very open, as Dr. Ratain mentioned, to seeing patients who have questions or haven't had their questions answered, seeing them in our COVID recovery clinic as well to help them sort out, do they need additional evaluation and treatment?
And how does somebody go about being seen at the COVID recovery clinic? Do they have to bring documentation for their test results, or how does that work?
A test result is not needed. Of course, if a test result was done and it was positive, that's very helpful. And that could either be the nasal swab or it could be an antibody test that was done later. If those tests were not available or not done, or even if you had those tests and they were not positive, but the story is very consistent with a COVID acute illness, then yes, those patients are welcome to be seen.
So, Dr. Ratain, can you walk us through the PCRC process? What does the initial evaluation look like, and how is a treatment plan determined from there?
Well, we've developed what we sometimes call a hub and spoke model, where the initial evaluation is performed by, as I mentioned, one of our hub physicians led by Dr. Burnet's group. And that group, the initial visit will be by video, and after that initial visit, there will be a plan for subsequent care, which could include follow-up with a primary care physician or one of our specialists or multiple specialists and representing the spokes. And we basically have numerous spokes, and including things that one would obviously expect, such as pulmonary, cardiology, but for example, there can be significant complications, testicular complications, infertility in males. There can be all kinds of issues, and of course, things that we don't yet know about. And so we are really prepared to address any new issue that is potentially related to COVID with one of our many specialists at the University of Chicago Medicine.
It's interesting. I was just reading, I think yesterday, in fact, that there are some instances where they're seeing some mental health issues from people who have had COVID. Have we seen much along those lines?
That's very common, unfortunately, and can include changes in mood, emotional changes, also sleep problems, and then this problem with difficulty concentrating. Students or people who are trying to work may experience what they often describe as brain fog and just really difficulty focusing on tasks that used to be normal for that individual.
And how long are we seeing those kinds of things linger? Is that something that's lasting quite a while?
Again, that is quite variable. And even in the literature and the reports that are starting to come out from around the world, from Europe and from our own centers in the US, some are reporting very high proportions of patients who have a variety of these symptoms and others much smaller proportions. And the length that these symptoms last, again, varies a lot. Most people do recover early on, but some people have this lingering tail of symptoms, and that can last weeks to months. Even the longest ones, though, we do see improvement. And the centers in the U.S., for instance, California, that were a little ahead of us in the curve, and when their populations began to be affected, those people are generally moving towards recovery.
Another question from a viewer. This one is, they say their significant other has been in quarantine for 2 weeks and has taken a test with a negative result, but he still has a lingering cough here and there. They would like to know how long that will last and if it's something to worry about.
So that's a case in which that individual is very unlikely to be infectious. That's the lingering, what we would call post-viral cough. So number one, I would not, the person should, of course, mask like we all do, but I'm not worried that that person's likely to infect others right now. How long the cough is going to last is not clear for certainly for any individual, but that individual can and should reach out to their physician, or again, is welcome to be seen in our post-COVID recovery clinic. That symptom, the cough, may last for weeks to even at a lower level for some months.
Another viewer question, and either one of you can take this one. This one's from Bonnie, and I think this is an important one because we are certainly coming into the flu season. Do you see cases of COVID-19 occurring at the same time as the flu? And I know we've really, really tried to emphasize to people to get that flu shot.
We don't have a lot of data on that yet. As you mentioned, we are just moving into the flu season, and we are somewhat worried and expecting to see some co-infections with flu and COVID. And again, that's why everyone should get their flu shot. We are not seeing a lot of that yet, but we expect we will see some.
Another question from a viewer, is it possible to contract COVID more than once?
Well, there's definitely been case reports, well-documented case reports, and in particular, to document somebody actually got it twice, one would need molecular characterization to prove that each time it was a different variant of the virus, because the virus, each person can have a slightly different virus. And so there are case reports of individuals that actually were surely infected twice because they were exposed on 2 different occasions, tested positive, and each time had a slightly different viral signature.
So Patricia has a question. If you get a negative test result but feel foggy and achy, should you assume it was a false negative?
I wouldn't say that necessarily, but it occurs in the context of, were you exposed? Again, if you were exposed to somebody that tested positive, you do need to quarantine for 14 days, regardless of a positive or a negative test. If somebody's experiencing, brain fog or some of these symptoms and is not sure if they had COVID, again, it's possible to have an infection, a COVID infection, without symptoms. And even in that case, possible to develop some of the sequelae that we've been discussing. So the next best step would be to see one's physician, possibly have an antibody test, which can give us some information. Those would be the next steps.
We are getting low on time, but we're having so many good questions from viewers. I'm going to try to get a couple more in if you all can do that with us. And this one, again, I think it's pretty appropriate. Vera works in a call center and cannot work from home. They're masking, wiping down workspaces. Is there anything more they can do? She's obviously very worried about the future.
Well, let me comment on that. We're currently doing some clinical trials to try and prevent COVID, and one compound of particular interest is vitamin D, and so there's certainly some evidence that vitamin D can prevent COVID. Individuals with vitamin D deficiency appear to have a higher risk of COVID and a higher risk of severe COVID. And so that would be one suggestion, is to take vitamin D on a daily basis. Basic hygiene, of course, and I don't think it would be unreasonable if someone is really concerned about COVID to wear 2 masks rather than 1 mask.
Yeah, and eye protection, again, we've heard more and more about that recently, and that's something I think that certainly could be stressed. Another question from a viewer. We're only going to get a couple more of these before we're out of time. If parents test positive, are the children considered like vectors and can transmit to others?
Well, within a family, of course, it is very easy to pass COVID back and forth. Within a family, when one individual tests positive or becomes ill, that individual, even at home, to the extent that's possible, should quarantine, use their own room, separate room if possible, stay masked at home, separate bathroom if possible. So those are some of the precautions. Now, anybody that's been within close contact of an individual who is positive, known to be positive, that individual, meaning in this case the child you described, needs to quarantine for 2 weeks as well.
So Dr. Ratain, we do have one follow-up question to something you said a moment ago about vitamin D. How much do you recommend on a daily basis?
Well, that's the question we're trying to study. So it's unclear what the right dose is. It's probably at least 2,000 units a day. It might be as much as 10,000 units a day. But there are also potential contraindications to high-dose vitamin D. So certainly a patient should discuss with their physician as to whether it's reasonable to take vitamin D, and if so, how much.
Great. We are unfortunately out of time. We've had a lot of great questions, and I know people still have questions. We will be doing another COVID at the Forefront Live a week from today, next Friday, so make sure you check that one out. We have other At the Forefront Lives next week, but that one specifically will be all about COVID. You two were fantastic. You shared a lot of great information with our audience, so thanks for doing this. And thank you to our viewers for your great questions. Please remember to check out our Facebook page for our schedule of programs coming up in the future. Also, if you want more information about UChicago Medicine, take a look at our website at UChicagoMedicine.org. If you need an appointment, you can give us a call at 888-824-0200. And remember, you can schedule your video visit by also going to the website. Thanks again for being with us today, and I hope you have a great weekend.